Hello, I am Dr. Rakesh Sarkar, presently working as a consultant cardiologist and electrophysiologist in BMB Heart Research Center. Today I am going to speak on the seasonal changes and the cardiac health. As you all know that there is an established entity of the cardiological events or the cardiovascular phenomena and the particular time frame of the year or the seasonal variation. Now, why we are talking so much on that particularly? We have seen that with the advent of fall or winter, there is an increased chance of the cardiovascular events, which is not ignorable. Now, what are the things which we often see to aggravate at the time of fall or winter? So these are nothing but acute coronary syndrome or myocardial infarction, or we see a lot of arrhythmias to happen. At the same time, some pulmonary embolism or deep vein thrombosis, even some aortic dissection or stroke, all can actually present to us with increased prevalence at the time of winter. So why this thing happens? So as we all know that winter is a time frame or the situation which is responsible for changes in the body which result in secretion of some neurohormonal chemicals, which is important to maintain the balance of the vasculature or the heart health. These neurochemical changes are important to maintain the integrity of the cardiovascular health, are responsible mostly for the occurrence of these increased events in the time of winter or a specific time frame in the year. There are certain situations which happens with the advent of winter. What are those changes? Now, with winter, we tend to actually go to some sedentary lifestyle, avoiding some routine exercise. We actually cut down our activity a lot. We tend to smoke a lot, or sometimes we often incline to some drinking just to avoid the burning less temperature effect. And at the same time, we often go for binge alcohol. The winter or the cold itself is not considered to be good for cardiac health because it increases the release of some chemicals known as non-epinephrine in the body, which can be responsible for a lot of cardiovascular events. And we see that some sudden cardiac death are also not very uncommon at the time of winter. At the same time, we need to also keep in mind that winter is a time when we actually gain a lot of weight, not only because of some increased intake of the food, but it is the normal physiological process by which urinate less, and at the same time we often prone to get a lot of infections in the form of respiratory tract or other like fever. So this can also aggravate some situations like heart failure and other things. So all these things together, winter is a situation which is not a very safe land or safe time to go ahead with some pre-existing cardiological problems, or we can say that even though you will not have any pre-existing cardiac problem, but you need to be very cognitive and careful about impending problem which can happen at the time of winter, knowingly or unknowingly. Thanks.